What if I told you? Your body often whispers warnings days, weeks, or even months before a heart attack happens? But here's the problem. Most people ignore those signals because they don't look like heart symptoms. They look like simple fatigue, mild chest discomfort, indigestion, pain in strange places. And by the time people realize what those signs meant, it's already too late. In fact, research shows that many heart attack victims experienced symptoms long before the actual attack. The question is, would you recognize those signals if your body was sending them right now? Today we're going to uncover the early warning signs your body may show before a heart attack. Some of these signs might surprise you. And one of them, almost everyone ignores. Stay with me, because the last sign is one many people mistake for something harmless. Let's start with something most people overlook. 1. Unusual fatigue. Not the normal tiredness you feel after a long day. I'm talking about a deep, unexplained exhaustion that seems to come out of nowhere. Many heart attack survivors later say something like this. I felt extremely tired for weeks before it happened. Simple activities suddenly become difficult. Climbing stairs feels exhausting. Walking short distances drains you. Even getting out of bed feels heavier than usual. Why does this happen? Because when the heart begins to struggle with blood flow, the body redirects energy to keep vital organs functioning. Your muscles receive less oxygen and less blood flow. And the result? Your body feels like it's running on empty. Here's something interesting. This symptom appears much more commonly in women, but men experience it too. So let me ask you something. Have you ever felt unusual tiredness that didn't make sense, even after getting enough rest? That might be your body asking for attention. 2. Chest discomfort. Chest discomfort is one of the signs most people associate with heart attacks. But here's what many people misunderstand. A heart attack does not always feel like a dramatic stabbing pain. Often it feels like pressure, tightness, burning, squeezing. Some people describe it as an elephant sitting on their chest. Others say it feels like severe indigestion or heartburn. The discomfort may come and go. You might feel it for a few minutes. Then it disappears. Then hours later, it comes back. This pattern is sometimes called unstable angina, and it can appear days or weeks before a heart attack. Your heart is essentially signaling something is not right. And ignoring that signal could be dangerous. 3. Pain in unexpected places. Here's where things get even more surprising. Heart-related pain doesn't always stay in the chest. Because of how nerves connect throughout the body, pain from the heart can radiate to other areas. For example, the left arm, the shoulders, the upper back, the jaw, the neck. Some people even feel pain in their teeth. Yes, teeth. Others feel a strange discomfort between the shoulder blades. That's why some people visit a dentist or chiropractor before realizing the problem is actually their heart. This is called referred pain. Your brain receives signals from different nerves and misinterprets the source. So if you experience persistent pain in these areas along with other symptoms, it shouldn't be ignored. 4. Shortness of breath. Another early warning sign is shortness of breath. Imagine walking across a room and suddenly feeling like you just climbed a mountain. Or trying to lie down at night, but you feel like you can't get enough air. This happens because when the heart struggles to pump effectively, blood backs up into the lungs. Fluid can begin to accumulate. And that makes breathing harder. Some people notice they become easily winded doing simple activities. Things they used to do comfortably now feel difficult. Many heart attack survivors say this symptom appeared weeks before the event. But they dismissed it as aging, stress, poor fitness. Sometimes it was actually their heart asking for help. 5. Nausea, indigestion, or stomach discomfort. Digestive discomfort is one of the most commonly ignored warning signs. Many people experience nausea, stomach pain, indigestion, bloating, and they assume it's simply something they ate. But during a developing heart problem, blood flow to the digestive system can change, triggering these sensations. This is why some heart attacks are mistaken for severe acid reflux. In fact, emergency rooms often see patients who thought they were experiencing bad heartburn, only to discover it was something far more serious. This symptom is also more common in women. So if digestive discomfort appears along with fatigue, chest pressure, or shortness of breath, it should never be ignored. 6. Cold sweats and dizziness. Your body also reacts to heart stress through the nervous system. That's why some people suddenly experience cold sweats, dizziness, lightheadedness, a feeling of impending doom. It can feel similar to an anxiety attack. But physiologically, what's happening is that the body is responding to reduced blood circulation and stress hormones. This sudden sweating often appears without physical exertion. If someone is sitting calmly but suddenly breaks into a cold sweat, it can be a warning signal. 7. Sleep disturbances. Here's one sign that almost no one talks about. Sleep disturbances. Some people report that weeks before a heart attack they experienced difficulty falling asleep, waking up suddenly at night, unusual restlessness. In some cases, people wake up feeling like they can't breathe. Others feel a strange sense of anxiety or discomfort in the chest during the night. These symptoms may seem unrelated to heart health, but they can sometimes reflect changes in circulation and oxygen levels. Your body is incredibly intelligent. Long before a major health crisis occurs, it often sends warning signals. The challenge is learning how to recognize them. Let's quickly recap the key signs your body may show before a heart attack. Unusual fatigue, chest discomfort, pain in the arm, jaw, neck, or back, shortness of breath, nausea or indigestion, cold sweats or dizziness, sleep disturbances. Experiencing one of these occasionally doesn't automatically mean a heart attack is coming. But when several appear together, or they appear suddenly and persist, that's when it becomes important to seek medical attention immediately. Because when it comes to heart attacks, time can save lives. And recognizing the warning signs early could save yours or someone else's. Before you go, I want to ask you something. Which of these warning signs surprised you the most? Tell me in the comments. And if this video helped you learn something important, like and subscribe to this channel for more health tips. Share it with someone you care about. You never know. It might help save a life.